Joining us now is Democratic Congressman Anthony Weiner of New York. He's on the House Energy and Commerce Committee and the Health Subcommittee. He is, of course, an outspoken supporter of single-payer health care. Congressman Weiner, it's nice to see you. Thanks for joining us.
It's my pleasure.
Is this a year when something passes, do you think?
Well, it better be. You know, the arc of cost to health care, whether it be to taxpayers or individual citizens or businesses, is just gone so high that, I've heard discussions, maybe we should trigger tougher action later on. Well, the trigger probably was this recession. I mean, that's got to be what is the eye-opener, that if we don't fix health care now, we may miss this opportunity. Now, I'm also concerned that if all it takes is a little shouting and the tip of someone's finger to throw us off the track, that I don't know when we're ever going to get back to this.
I don't know that the tip of that man's finger is going to help or hurt anybody's case here. It certainly is a symbol of the drama and of the heat of the rhetoric on both sides. But I suppose there's two historic ways to think about this. One is to think of this as the historic one shot that we've got. This is the one time that we've got to take a bite of this apple, as they say, and as I think I've heard you say before. The other way to think about this as part of a long, hard slog, the way that we got Medicare. Do you think this is a special chance, a special opportunity, and if we don't get it now, we really won't get it for a long time?
Well, we're kind of painted into the corner of the financial straits that we're in. To some degree, one of the increments was supposed to be when we passed Medicare Part D, that folly of a plan that we gave $730 billion to the insurance industry to try to come up with a prescription drug plan. They brought us the donut hole and $400 billion of additional spending on top of it. We've kind of tried this for quite some time. We are having such a strain on our economy that if we don't get cost contained, that if we don't stop and change the way we're doing things, every day 15,000 Americans are losing their health insurance. Say we're going to wait another couple of years, that's tens and hundreds of thousands of Americans that'll have to go without insurance while we get this mess cleaned up. This really is our chance, and it's something else. This is what President Obama campaigned on. So we mustn't walk away and say, listen, we got a little increment. That's not the change that a lot of people think they voted for.
Well, where do you stand on the importance of the president's speech next week? How important do you think it is in terms of actually getting legislation through Congress and getting it through now?
Oh, it's big. David Axelrod said on your show that this is like we're in the ninth inning. That's not true. Our cleanup hitter hasn't even come to the plate. We're kind of like, not to get another sports metaphor in here, but it's kind of like in hockey when the ref sits back and lets a couple of players fight for a couple of minutes before they separate them to get back to the game. We've been in a scrap through the month of August, but we really haven't had presidential leadership in the way that we need it most. If he stands up on Wednesday and says to the country and to my colleagues in Congress, we are going to have a public option in this plan because we need it, and here's why, it's going to get done. If he doesn't, we're going to have to settle for less, and that'll be a tragedy.
Let me pose one question to you about long-term versus short-term effectiveness. Some of the reasoning on the left in particular goes that if the health reform battle fails, if there isn't health reform this year, Democrats will look so weak that they weren't able to pull it off with this big a majority, with the huge win they had over the Republicans in 2006, 2008, that they are setting themselves up for losses in 2010 by virtue of losing this now. That's one way to think about it. The other way to think about this is that Democrats are defining for a generation now health care as a Democratic issue that Republicans don't want to fix. And it's something that Democrats can campaign on, whether or not they get it, against Republicans at this next election, the one after that, the one after that, the one after that. Which way do you come down on that?
Well, I basically believe that there's a way to get a health care bill passed this year that doesn't do all that much, that makes some incremental nods towards, not allowing insurance companies to take pre-existing condition into consideration, those types of relatively modest changes to the insurance system. But, the problem that we have in this country now, that all of the 80-20 easy problems have been solved. We've got nothing left but 45-45-10 problems, half-half with 10 undecided. These are tough issues. President Obama was elected to take on these tough issues. And I think what he'll find is the American people, now that we're kind of at a point where we're done shouting and yelling at each other, now really want to try to get something done. If he really puts his pedal to the metal, I think this is the moment to get it done. I don't think it's irretrievable if we don't, but I really do think it would be a huge missed opportunity.
New York Congressman Anthony Weiner, really appreciate your time tonight. Thanks for joining us.
Thank you, Rachel.